when Labour came in last year, they got their checkbook out in order to stop strikes in the NHS. They thought that was a big priority, and it was a hugely controversial measure at the time and remains so. And over 2 years gave resident doctors, junior doctors, a 20% plus pay rise. And actually, resident doctors came out on top of the recent round of pay awards to public sector workers, but that hasn't been enough. And they have now decided that they're going to press the strike button. 90% of doctors in the BMA ballot voted in favour of industrial action, but the turnout was only 55%, meaning that only about a third of the 77,000 resident doctors working in the NHS actually voted in favour of this. Wes Streeting has said he will not forgive them and the public will not forgive them. And clearly, this is something that is going to disrupt the rollout of possibly the most important policy area that Labour needs to fix.
I think this government, occasionally you find yourself looking at a Labour government which came in saying we're going to do things very differently to the Conservatives, but then the same problems keep seeping through the system. Jeremy Hunt, if you remember, had that very bitter and long standoff with junior doctors, as they were then known, and he had to face them down over time. But I think it did eat into the reform agenda, because when you're involved in those long-running tensions and strike action affecting a lot of the NHS, it's pretty hard at the same time to be motivating people to get on with the bigger changes that you want to make. Well, this does look, doesn't it, like it is coming back to Wes Streeting, who only a week ago, and I think he still feels that his 10-year plan, for reasons outside his control, obviously to do with the wheels coming off the government over the welfare bill, it hasn't had quite the attention that he would like it to have. But he's had to really pivot pretty hard. The message seems tough from Streeting that the public won't forgive doctors, the resident doctors, if they do strike. So there again, you're back into a kind of conflict vibe rather than a let's rebuild the NHS for the future. Now, I'm sure he will want to say that he can do both, but this does look like something that could eat into a bit of the bandwidth that the government needs on healthcare reform. I don't know if you agree with that. Just putting two and two together, I just felt like I'd seen this movie before.